Have you been taking your medications every day for years, yet never stopped to ask yourself one important question? Are you completely sure that the way you are using them is truly safe? It is not only taking the wrong medication that can put you at risk. Sometimes, it is the small habits you repeat every single day, habits that seem harmless, that quietly wear away at your health, and you will not realize it until a serious event forces you to. After 60, the body no longer reacts as quickly as it once did. The liver, kidneys, heart, all of them slow down. This means that even one small mistake in how you take, store, or combine medications can cause far more serious consequences than it would have years ago. The most concerning part is that these mistakes often happen to the very people who consider themselves careful, simply because they believe they are too familiar with their medications to make an error. In this video, I will reveal 5 common mistakes that pharmacists across the United States and Europe are warning about, mistakes that, if avoided, can dramatically reduce your risk of hospitalization, complications, and even death. These are not unfamiliar facts, but I believe the way you see them after watching this video will be completely different. If you have ever skipped a dose thinking, missing one will not matter, stored your medications in the most convenient place without considering temperature or humidity, or taken an extra pill because you felt your symptoms had not improved yet, then this video is for you. Because just one small change, starting today, could save you from a health crisis you never needed to face. 1. Not following prescriptions. Have you ever thought that just one missed pill, or stopping a few days early, could bring your entire treatment plan crashing down? The danger is, most people do not even realize it until their body starts speaking up, and by then, things are often much worse. After 60, following your prescription exactly is not just doing what the doctor says. It is the thin line between stability and a health crisis you never saw coming. When your doctor prescribes a medication, every dose, every time of day is calculated around your condition, your body's rhythm, and the way that drug works inside you. But many older adults unknowingly disrupt that careful balance. They stop early because they feel better, skip a dose because they forgot, or take it at the wrong time because life got in the way. These seemingly small actions can unsettle the body's delicate systems, allowing disease to return, complications to appear, and sometimes starting a much harder battle than the one you thought you had already won. Imagine you are treating an infection with antibiotics. After a few days, the fever breaks, you feel stronger, and you decide to stop. What you do not see is that inside your body, some bacteria have survived. They do not just linger, they adapt, becoming stronger, resistant to that medication. In the United States, the CDC estimates that more than 2.8 million antibiotic-resistant infections occur each year, claiming about 35,000 lives. For older adults with weaker immune systems, the result can be infections that drag on for weeks, repeated hospital visits, and recoveries that take far more out of you than they used to. It is not just antibiotics. Stopping medication for chronic conditions can be just as dangerous. Imagine you are taking blood pressure medicine but run out or think, "I will be fine," and skip a few days. Your blood pressure does not just return to what it was, it can surge even higher than before, a phenomenon called rebound hypertension. The outcome? Severe headaches, dizziness, chest pain, and in the worst cases, a stroke or heart attack. For diabetes, suddenly stopping pills or insulin can send blood sugar soaring, leaving you exhausted, constantly thirsty, and over time, damaging your kidneys and nerves. Equally risky is missing or mistiming doses. One forgotten blood thinner pill can open the door for a clot to form, leading to a pulmonary embolism, a heart attack, or a stroke. For someone with epilepsy, skipping a single dose of seizure medication can bring the seizures back, risking injury from a fall. A person with diabetes who injects insulin at the wrong time or eats off schedule can experience blood sugar swings so severe they cause confusion, fainting, or even a medical emergency. The most dangerous part? These consequences often do not happen right away. They creep in slowly. Uncontrolled blood pressure leaves you tired, unable to focus, and less interested in the things you love. Blood sugar swings can change your mood, make your thinking foggy, and affect your relationships. Your health slips, your confidence drops, and soon you are driving less, going out less, seeing friends less, and the cycle of illness, isolation, and lost independence begins. The good news is, you can take back control. Small but consistent habits make a huge difference. Set alarms, use a weekly pill organizer, carry an updated medication list for emergencies, and never stop a drug without talking to your doctor first. If side effects or costs make it hard to stick to your plan, speak up. There may be other options that work just as well for you. Remember, every pill you take on time and at the right dose is like laying a brick in the wall that protects your health. And sometimes, it takes just one missing brick for a crack to form. Take care of every single one, because that is how you protect your independence, your strength, and the moments that matter most with the people you love. 2. Improper storage and expired medicine. Did you know that even if you take your medications faithfully, one small mistake in how you store them can make them almost useless? What is more alarming is that this often happens silently, without any obvious warning signs, until your body speaks up, and sometimes that voice comes as a heart attack, an asthma attack, or a diabetes complication you never saw coming. Medications are not only sensitive to your body, they are sensitive to the environment. Heat, humidity, and light can quietly alter their chemical structure, making them weaker or even harmful. Yet many people still unknowingly keep them in familiar but risky places: the bathroom, the kitchen, or the car. The bathroom may seem convenient, but steam from showers and baths is the enemy of your medications. High humidity causes pills to absorb moisture, clump together, lose potency, or break down more quickly. A bottle of aspirin stored here may lose effectiveness early, and when taken, the altered active ingredient can irritate the stomach. The kitchen is no safer. Heat from ovens, stoves, or microwaves can destabilize medications. Nitroglycerin tablets, life-saving in moments of chest pain, lose their strength quickly when exposed to heat, leaving you unprotected during an emergency. In cars, temperatures can swing from freezing in the winter to over 100 degrees Fahrenheit in the summer. For insulin, just one exposure to extreme heat or cold can strip away its ability to control blood sugar, leading to dangerous and unpredictable fluctuations. The problem is not only where you store your medications, but also how long you keep them. Expired drugs are not just less effective, they can sometimes be harmful. Certain older tetracycline antibiotics can degrade into compounds that damage the kidneys. Aspirin breaks down into acetic acid, which smells like vinegar, and salicylic acid, which can erode the stomach lining, increasing the risk of gastrointestinal bleeding, a serious concern for older adults with sensitive digestive systems. Even insulin, which does not noticeably spoil with time alone, can lose its power if stored incorrectly, leading to poor blood sugar control and greater risk of complications such as nerve damage or vision loss. The effects of damaged medications do not usually strike like lightning. They creep into everyday life. A weakened albuterol inhaler can leave you breathless climbing stairs or walking uphill. Prolonged high blood sugar from ineffective insulin can sap your energy, blur your vision, and make it hard to focus on even the smallest tasks. Over time, you lose the ability to live life on your own terms, give up activities you enjoy, and rely more heavily on others. The good news is that you can prevent all of this with a few simple but consistent habits. Keep medications in a cool, dry place, away from the bathroom and kitchen. Use sealed containers to protect them from moisture. Always check expiration dates and dispose of outdated drugs through pharmacy take-back programs. Never leave medications in the car, and if you travel, carry them in an insulated container. Most importantly, if you notice changes in color, texture, or smell, such as clumping pills or a vinegar odor, ask your pharmacist before taking them. Every pill you take is a promise to care for your health. Do not let careless storage break that promise. Storing your medications properly is not just about preserving their strength, it is about preserving your body's protection, so you can continue to live independently, stay healthy, and enjoy every moment to the fullest. 3. Ignoring interactions and side effects. Did you know that sometimes the very pills you take every day can work against each other, or join forces with an innocent-looking food to create dangerous consequences? For those over 60, who often take multiple medications at once, ignoring the risk of interactions or downplaying side effects can open the door to serious health events that quietly change your body day by day. Not all medications get along with each other or with certain foods, drinks, or herbal products. Some combinations that seem ordinary can push a drug's effects dangerously high or make it drop so low it becomes ineffective, and both situations can be harmful. Imagine you are taking statins to lower cholesterol. A glass of grapefruit juice every morning, which feels like a healthy habit, can block the enzyme that helps your body process statins. The result is higher levels of the drug in your blood, increasing the risk of rhabdomyolysis, a rare but extremely dangerous condition that can destroy your kidneys. At first, you might only feel mild muscle pain or weakness, but in just days, the situation can escalate into an emergency. Or consider taking warfarin to prevent blood clots. A daily cup of green tea, which seems harmless, can quietly reduce the drug's effect because of its vitamin K content. This neutralizes its blood-thinning ability, and even small fluctuations can put you at risk of developing a clot, or, if the blood-thinning effect swings too far the other way, you could bruise easily, bleed excessively, and feel exhausted. Even more alarming are the interactions between alcohol and opioid pain medications. Just one glass of wine while taking these drugs can slow your breathing and heart rate, make you dangerously drowsy, and cause you to lose focus. For older adults, the risk of breathing stopping during sleep or accidents in the kitchen or behind the wheel is very real. It is not only medications and beverages. Some natural supplements can cause just as much trouble. St. Nodi, John's wort, a common herbal remedy for depression, is a powerful trigger for liver enzymes that speed up the breakdown of many other drugs. This can make blood thinners, antidepressants, or post-transplant immune suppressants less effective. In fact, there have been transplant patients who faced organ rejection simply because they unknowingly took this herb. The effects of these interactions do not always reveal themselves immediately. Reduced effectiveness of an antidepressant can quietly drain your interest in hobbies or social activities. Lowered protection from a blood thinner can lead to unexplained bruising, swelling, or ongoing fatigue that limits your daily movement and shrinks your social life. Side effects themselves are often ignored because they start off so small. For example, certain blood pressure medications can make you dizzy when you stand up quickly. For older adults, that means a higher risk of falling, the leading cause of serious injury and injury-related death in this age group, according to the CDC. Or, for some antidepressants, stopping suddenly can cause brain zaps, which feel like electrical shocks in your head, disturbing your sleep and making it hard to focus. The key is to take charge of your safety. Always share your full list of medications and supplements with your doctor and pharmacist. Avoid or limit high-risk foods and drinks that may interfere with your prescriptions. If you notice anything unusual, whether it is fatigue, muscle pain, bruising, or shortness of breath, reach out to your healthcare provider immediately. Remember, the vigilance you show today can save you from a medical emergency tomorrow. Making sure your medications work together in harmony is one of the most powerful ways to protect your health, preserve your independence, and keep living each moment to the fullest. 4. Outdated medication list. Imagine being rushed into an emergency room, unable to say a single word. In that moment, the list of medications you take could be the only bridge helping doctors understand your body, or it could be the very reason they make a dangerous mistake. For those over 60, often managing multiple prescriptions and complex medical histories, an outdated or incomplete medication list is not just an inconvenience, it can be the thin line between survival and losing the chance to recover. In an emergency, every second matters. If your medication list is inaccurate, the medical team may misinterpret your condition or unknowingly administer a drug or treatment that is unsafe for you. Picture this: you are unconscious, showing symptoms that look exactly like a stroke, but because no one knows you are not taking opioids, first responders inject Narcan to reverse an overdose. While Narcan will not harm you if opioids are not in your system, those few minutes lost before proper stroke treatment could mean the difference between saving brain tissue or living with permanent damage to your movement or speech. Or imagine you are on an MAOI for depression and do not disclose it. An emergency procedure requiring anesthesia could turn deadly if the wrong drug is used, triggering a hypertensive crisis, serotonin syndrome, or cardiac arrest. Even with modern medical protocols, the choice of medication still depends on the information you provide. Without it, the risk rises sharply. For those taking ACE inhibitors for blood pressure or heart failure, Receiving potassium without prior checks can cause potassium levels in the blood to spike dangerously. This can easily lead to life-threatening arrhythmias, especially in older adults with kidney disease or diabetes. An unstable heartbeat can leave you dizzy, weak, and just one fall away from a life-altering injury. The danger does not end in the emergency room. In routine appointments, an incomplete or outdated list can lead your doctor to accidentally prescribe duplicate medications or doses that are too high. The result may be prolonged side effects, fatigue, dizziness, or digestive discomfort. These may seem minor but can quietly drain your energy, pull you away from the activities you love, limit social interactions, and sometimes create tension at home when loved ones notice shifts in your mood or behavior. The solution is not complicated, but it does require your commitment. Treat updating your medication list as a regular part of caring for your health. After every change, whether a dose adjustment, discontinuation, or addition, revise the list and print a fresh copy. Keep one in your wallet or purse, with the drug names, doses, and schedules clearly written, along with any allergies and supplements you take. Set up the medical ID feature on your phone so emergency personnel can access the information even if the device is locked. Share the updated list with family members or caregivers who can speak for you if you cannot. A complete and accurate medication list is not just a sheet of paper with names and numbers. It is a map guiding your doctors in critical moments, a shield protecting you from preventable medical errors. Keeping it up to date means giving yourself the best chance for recovery, safeguarding your health, and preserving your independence in every situation. 5. Changing doses or sharing medicine. Just one instance of changing your dose on your own or borrowing someone else's medication can be enough to throw your body's balance completely off. The danger lies in the fact that many people think it is only a temporary trick or a way to save time. But in reality, for those over 60, these actions can open the door to a chain of serious health risks, both immediate and long-term. Many believe, my medication is the same as my relatives, so taking theirs for a while will be fine. But dosage, formulation, and personal health conditions are different for everyone. A friend may be taking a blood thinner at 10 milligrams per day, while your body only requires 5 milligrams. That small difference can be enough to make your blood dangerously thin, leading to bruising, nosebleeds, or even life-threatening internal bleeding. Likewise, taking antibiotics borrowed from someone else can result in severe allergic reactions, including anaphylaxis, with symptoms such as swelling, difficulty breathing, or a rapid drop in blood pressure. These situations do not just send you to the emergency room, they can leave you feeling anxious and drained long after, disrupting your daily life. Equally dangerous is changing the dose of your own prescribed medication without guidance. Many people with diabetes intentionally skip one or more insulin injections to eat more freely or try to lose weight. This can cause blood sugar to rise sharply and lead to diabetic ketoacidosis, DKA, a life-threatening condition that can progress to a diabetic coma and death if not treated in time. On the opposite end, some people double their dose of medication for attention deficit hyperactivity disorder, ADHD, in hopes of increasing focus. But doubling stimulant medication can cause the heart rate and blood pressure to spike, triggering arrhythmias or heart failure, especially dangerous in older adults or those with pre-existing heart disease. Long-term medication misuse can also leave behind persistent and damaging effects. With thyroid medication, such as levothyroxine, consistently taking less than prescribed can keep the body in a state of fatigue, weight gain, and depression, while quietly increasing the risk of heart disease. With antibiotics, taking less than the prescribed amount or stopping early does not just prolong illness. It contributes to the global crisis of antibiotic-resistant bacteria, a threat that, according to the World Health Organization, claims the lives of more than 1 million people every year. These consequences do not stay confined to medical charts. They weave their way into your everyday life. High blood sugar from skipped insulin doses can cause frequent urination, blurred vision, and trouble concentrating, making activities like reading or cooking difficult. Side effects from doubling ADHD medication can leave you restless, anxious, and fatigued, pushing you away from social activities. Over time, these changes can lead to isolation, loss of confidence, and an increased risk of hospitalization. Your health is the sum of hundreds of small decisions you make each day, and following your prescription exactly is one of the most important of them. If you ever have questions about your dosage, side effects, or lifestyle changes, speak directly with your doctor or pharmacist instead of adjusting your regimen on your own. Every prescribed dose is determined based on an understanding of your specific condition and needs. Respecting that is not only respecting the science of medicine, it is respecting your own health and your future. Health is not the result of a miracle. It is the outcome of small choices, repeated day after day. Every pill you take on time, every moment you store your medications properly, every decision not to test or take a chance is a step toward protecting yourself from risks that can be avoided. After 60, your body needs you to listen more closely, be more patient, and respect every signal it sends. If today you realize that you have been making one of these mistakes, do not rush to blame yourself. Simply start changing now. One small action, one new habit can open the door to a healthier, more resilient future. Your health is a gift, not only to yourself but also to the people you love. If you found this video helpful, I invite you to leave a like, share it with someone who might need to hear this today, and subscribe to the channel so we can continue walking this journey of health together. Because every story, every piece of timely information, can be the lifeline someone out there is waiting for.